Welcome. My name is Peter Strong, and I offer Skype Therapy for the treatment of anxiety and depression. So if you're looking for Skype Therapy to help you overcome anxiety or depression, then I invite you to take a look at my website and then email me through my contact form with any questions you may have about Skype therapy and how it can help you. So Skype therapy is a great choice if you are looking for an alternative to medical-based treatment for anxiety or depression. Many people are looking for something other than medications. Many of my clients have already tried medications, and the general consensus is that antidepressants and anti-anxiety medications really don't seem to address the underlying problem. They seem to provide a short-term solution, perhaps reducing symptoms, but they do nothing to change the underlying cause of your anxiety or depression. So during the Skype therapy sessions that I teach, I will be showing you how to work at the core level of your anxiety or depression using the techniques of mindfulness therapy. This is a very effective way of changing the underlying conditioned habitual processes that cause your anxiety and depression. And these are psychological in nature. They must be changed by a psychological intervention, of which psychotherapy is the right approach. But you have to approach it in the right way, using the right kind of psychotherapy. So again, talk therapy is generally not that effective because it's not really getting to the root cause of your anxiety or depression. So in mindfulness therapy, we try to change things at this fundamental level. And we do that not by talking about your emotions so much, not by trying to uncover family history and the like, but really by simply focusing conscious, mindful awareness on exactly how that anxiety or depression is manifesting right now. So we can look at the underlying process that is generating that anxiety or depression or other emotional problems. If you really want to change something, you have to change it in the present. You can't change history, but you can change the way that you relate to your memories. So we learn essentially how to meditate on our emotions. This is the primary vehicle for change and for promoting healing and recovery. Best way to think about anxiety or depression or other forms of emotional suffering is to see them as being like a wound. Okay? Now that wound already knows how to heal itself if it's given the right conditions for healing. If you take care of it, if you keep it clean, and it will then automatically start to heal. While your anxiety and depression and other emotional wounds are very similar to this. They already know how to heal themselves. The problem is this conditioned reactivity. So this is what is preventing anxiety and depression healing. And conditioned habitual reactivity by its nature operates subconsciously. We're not really consciously aware of what's happening. we simply suffer the consequences of these underlying habitual patterns of reactivity. So the central focus in mindfulness therapy is to uncover these habits, the habits that cause anxiety and the habits that cause depression. We want to see those habits very clearly. When you bring conscious awareness to them, that allows you to break free from that automatic, blind quality of the habit. So we learn to meditate on our emotions. Meditation is the primary vehicle for seeing what's going on in the mind. We then practice and train to stay present with our emotions without becoming reactive, without becoming identified with them, without becoming sucked in to those patterns of reactive thinking and rumination that feed anxiety and depression. So that the more you see, the freer you become. And then from that place of freedom, you're better able to respond skillfully in a way that helps the anxiety or depression heal. And that is very much about developing internal compassion towards your emotional pain. That's what it really needs for healing. And that's what's usually missing when the mind becomes reactive. So there are many aspects of mindfulness therapy. I'd be happy to teach you and explain to you in more detail. If you would like to really get to the bottom of your anxiety or depression and really promote lasting recovery and healing, then I advise you to consider mindfulness therapy. Now, people like online therapy because it's convenient, and as long as you use Skype, then it's just as effective as meeting in person with a therapist. You don't need to be in the same room as the therapist, but you do need to see each other. So if you'd like to learn more about online mindfulness therapy via Skype, then please contact me and let's schedule a Skype therapy session. Most people see tremendous improvements in a relatively short time, often in the first 3 or 4 weeks, once you start applying the mindfulness techniques that I'll be teaching you during these Skype therapy sessions. So please contact me if this interests you. Thank you.